Our main news here this morning, there are calls this morning for a radical shake-up in the way hospitals in England and Wales treat dementia patients, after a survey showed that only a third of staff feel that they've had enough training for the job.
The audit by the Royal College of Psychiatrists also found that treatment is often given in an impersonal manner. Care experts describe the findings as shocking, and ministers have promised swift action. Our health correspondent Bronwyn Jeffries reports.
We rigged up a tent on the beach. Do you remember?
Yeah. Mary Goulden's daughters are full of fond memories of their mum, but they're also angry and frustrated about some of her hospital treatment before her death. Mary was in pain from a fracture, but the family felt her distress was dismissed, and their concerns that her dementia was poorly understood also went unheard.
I personally felt that they thought we were a nuisance, that we were overreacting, that they knew better than us and we should just go along with their treatment. They knew best.
This audit of dementia care in hospital raises similar concerns. Just 32% of staff said they'd been trained enough about dementia. Only 40% of hospitals had policies on informing families about care. And just 38% of wards were using clear, bold signs that are easier for patients with dementia to read.
Now that our hospitals are dominated by older people, and particularly people with dementia, we really need to move on from what used to be the type of care provided in the 70s and 80s. Dementia care is now a lot of what hospitals do, and they need to be ready to respond to that.
Health officials accept improvement is needed in hospitals. In England, from next year, trusts will get financial incentives to check every patient for dementia when they're admitted. Bronwyn Jeffries, BBC News.
Well, today's audit follows a number of critical reports into elderly care in recent weeks. Back in October, the Care Quality Commission found alarming levels of neglect in 1 in 5 hospitals in England, ranging from poor hygiene to a disregard for the dignity of patients. On the 9th of November, the Patients Association published a report giving 16 examples of poor hospital treatment and said that some elderly patients have received shameful levels of care in parts of the NHS. And in late November, the government's equality watchdog said that care for some elderly people in their own homes is so bad in parts of England that it could breach their human rights. Well, joining us now from our studio in central London is Hannah Clark from the Alzheimer's Society. Good morning to you, Ms Clark. This call for a radical shake-up, does it surprise you?
It doesn't surprise us. This report confirms exactly what we did know, that there's a huge variation of the standards of care out there for people with dementia. So we know that some hospitals do a really, really good job, and that makes all the difference to people's lives. But unfortunately, this report also shows that many hospitals, too many hospitals, are actually delivering poor care that is making people worse, both in terms of their dementia and in terms of their physical health. So they're going into hospital and they're coming out in worse health than when they went in, which is really shocking, and we need that to change.
What particular complaints are you getting from people whose relatives have Alzheimer's?
Well, one particular shocking example that we did hear was of somebody whose loved one went into hospital, who was able to walk, talk, dress themselves, go to the toilet. They went in for a fairly routine operation. It was a hip replacement. And actually, when they came back out of hospital, they were a completely different person. So they weren't able to walk and talk. They weren't able to dress themselves. They really felt like their loved one had been lost to them. And that is, it's an extreme example. It doesn't happen in every case, but it is just one of the many things that our helpline hears of, where we know that we can do a better job just by making really small and very simple changes that can have a huge impact on people's lives.
We'll go on to those small changes just in a moment, but in that particular case, what on earth had gone wrong? Was it simply a lack of caring, a lack of attention?
It's a whole systems approach that needs to happen, but what happened in this particular case was that the person wasn't able to feed themselves, wasn't able to drink water. That led to them becoming particularly dehydrated and becoming very prone to infection, and that then led to other complications. So what starts off as a very simple hip replacement actually ends up having that person stay in hospital much longer than many other people who go in for the same operation, having added complications and coming up weeks later on particularly dangerous drugs as well that have been added to try and help care for them, but have actually had really serious effects that have robbed them of that quality of life. And this is one example, but we know that it does happen across the country, and we need to stamp out that sort of care.
Well, let's talk about the little things that you say could really make a difference. I mean, just from my own personal experience, I know taking somebody to hospital with Alzheimer's, we waited a couple of hours before they were seen, and by this time the person was incredibly distressed. That is one way, but presumably you'll tell us many more.
Absolutely. For you and I, hospitals are always going to be a scary experience, but if you imagine what they're like for people with dementia, they can be absolutely terrifying. So if you don't know what's going on around you, if you're in pain, if somebody comes along and is trying to help you, but you don't know who they are or what they're doing, you can just imagine the sort of feeling that that would give you. And that can cause all sorts of complications to care and also cause people to have that terrifying experience that you mentioned. So small changes like allowing people to keep photos of loved ones by their bedside that might reassure them, having signs up so people can negotiate around a hospital wards, and having staff trained in dementia. This is the particularly really important thing that we need to see. Staff trained in communicating, in telling you what's going on, in being able to spot the signs, spot if you need some additional help. That's so important. But this report showed that only 33% of staff actually felt that they had the right training, despite a quarter of all hospital beds being taken up by people with dementia. So that's a really big mismatch that we need to address.
Yeah, and that's what thing we've been talking about this morning is, you know, the nurses are incredibly hard working. A lot of cases they're overstretched, they're overworked. You say only 30% are trained in dealing with dementia. Many more would like to be, but would they have the time to do this? Or is it just a matter that we need more resources putting in to deal with this?
Well, nurses don't go into caring to do a bad job, do they? They really want the tools and training. They know they can make a difference, and we know that these small things have a huge impact on people's lives. What we do know is that actually good care can actually save money. So if we get people with dementia out of hospitals sooner, then actually that could save the NHS £80 million, possibly much, much more, hundreds of millions of pounds. So it makes economical sense to deliver this training, but also we know that staff want it, we know that it can make a real difference, and we need to really see it happen to have a big impact on people's lives, because of course staff are coming into contact with people with dementia every single day that they're going into work. So this needs to happen and training needs to be delivered to everybody.
Hannah Clark from the Alzheimer's Society, many thanks.
Thank you.